So hi students, today I'll be covering all the important questions which has been recalled in your FMGE exams. So I've arranged the questions in chapter wise so that you'll get an idea like which chapter has been given more importance, what are the important topics which has been asked in your exams. So that once we analyze the questions in chapter wise, it becomes easy for us in the future exams also, like what we need to focus on. So let us go questions one by one. The first question was on study designs. So the question was typically asked on case control study. So every exam they're asking questions on case control study. Either they will ask the study design or they will ask the analytical part. This time they have given a simple question asking what is the pattern of the study. Like if they are giving cases and if they are taking controls, they are taking the history of exposure. So there are three words like the study was conducted to compare history of MMR vaccine and association with autism. Like they have taken two groups, one group case, the other group control. So cases means with disease, like the other group for comparison without disease, like without autism. Then they are checking the history of MMR vaccine. Is there any positive association or not? So what is the next thing they are checking? They are checking the exposure pattern. So there are three words: cases, controls, and study. In study, they will take the exposure in a retrospective way. So the study, what you are doing is for association, and the study is case control study. If they ask one more question, what is the way to do a study? It is deceased and non-deceased. The third thing what you take is history of exposure. Later you analyze by giving odds ratio. If it is more than one, positive association. If it is less than one, negative association. So this is the basic framework of case control study. Repeat with me, good. Deceased, non-deceased, exposure. Then you analyze by giving odds ratio. So what is the answer for this question? Case control study. Come to the next question. Hand washing during COVID-19 pandemic. You'll be knowing, like we used to advise hand washing after any procedure. So the risk factor is always present. What I am telling is risk factor is always present. You don't want disease to develop. So before risk factor, if you are doing, that is primordial level, but with risk factor, if you are doing, the answer is primary level of prevention. So hand washing will come under which mode of primary level? If they ask, it is under health promotion. It is under health promotion. So there are two modes of primary level. One is health promotion, the second is specific protection. Hand washing is a part of behavior modification. So hand washing will come under health promotion. So what level of prevention? Question was easy. They're not asking what mode of intervention within primary level. We have two things like health promotion, specific protection. Hand washing is a part of health promotion under primary level of prevention. Why we are advising hand washing? Because there is risk factor present. One more question on primary level of prevention. Tobacco control laws means they want to restrict the use of tobacco, banning or smoking cessation. These are the things what they will advocate. Either they will ban the risk factor or they will ask you to stop smoking. Tobacco control laws means it is controlling the risk factor modification. See the words properly. Very good. It is risk factor modification. Risk factor modification is again a part of primary level of prevention. If you are preventing the risk factor, like you are advising school children not to smoke in the future, you are avoiding the risk factor itself. That will be primordial level. But here the question is risk factor present and you are asking them to restrict, ban, or you are reducing the usage of tobacco. See the words what the examiner is asking. Tobacco control laws. But if they frame a question like avoiding the risk factor, You are advocating small or any school children not to smoke in the future. When they frame question like that, they want answer as primordial level. But here, tobacco control means risk factor modification. So risk factor modification, how the words will come? Control, banning, cessation. These words you have to check in the exam. It is always about picking the keywords. Once you pick the keywords, then you'll come to know what the examiner wants. You should mark the answer based on the keywords in the exam. Got my point? It is tobacco control. Again, the answer is primary level of prevention. Infectivity is measured by what indicator? Usually the word in the exams will be direct, like they ask communicability. Some examiners, they are using the word infectivity also. So fine. So indirectly they are asking, I've seen some papers where the question has been asked like this also in the previous exams also. But direct answer is on the communicability part, that is secondary attack rate. But if the word infectivity comes, the rate of spread, there is no other answer like case fatality rate, serial interval incubation period will not measure this part of communicability of disease from patient to patient. Like if there is a primary case spreads disease to secondary cases. The number of secondary cases which happened in the family, number of secondary cases which happened in the family divided by susceptible contacts. This is the formula for secondary attack rate. Secondary cases which happen divided by susceptible contacts. That indicates the communicability of disease. How much communicable? It can be 80%, it can be 90%. So note down the formula for secondary attack rate. It is S by S. Secondary cases by susceptible contacts. So the answer is secondary attack rate. Which of the following is true regarding common source single exposure outbreaks? Means the question is like this. I'm telling again, we call it as point source exposure. Point source exposure. So it's a question which has been asked in most of the exams. What is happening in a single exposure? There is sharp rise, sharp fall in the number of cases. There is one wave. There is no secondary waves. Keep this in mind. There is no secondary waves. All the cases happen within one incubation period. All the cases which happen within one incubation period, like food poisoning or any contaminants which has happened long back, like Bhopal gas tragedy, Chernobyl gas incidents, all this happened and there is no extension of cases after one incubation period. After one incubation period means it can be a continuous source like contaminated well which is hidden in the system. People are coming again and again and getting exposed to that source. That is continuous exposure, or it can be person to person. That is propagated epidemic. All those epidemics in which cases can happen after one incubation period. Multiple waves can be seen, but that is not seen in single exposure point source outbreak. So cases develop after one incubation period? No. Multiple waves seen? No. Clustering of cases not seen? No. We have clustering of cases. So these are the options which has been recalled almost similar to this, and based on the options what you have recalled, we are giving the recall part and the answer is no secondary waves. This is suiting because they are asking which of the following is true, or if there is any change in the options you can let us know, but you should know the basic part, what is the difference between single exposure and continuous exposure. That was the purpose of the question what the examiner is asking. One question they have asked on vaccine part. They have linked the question with maternal health. They have asked the question like a pregnant is coming to the clinic. So a pregnant is coming to the clinic in her second trimester, fine, with a 2-year-old child. Means she has conceived before, she has vaccinated before, she has been previously vaccinated. So the question is, she is not a new pregnant, she has been vaccinated before. So what is the vaccine used now is TD vaccine. So option A, TT, booster TT is ruled out. Now you have to think whether we give 2 doses or we have to give booster. Since she is conceiving within 3 years, she has been vaccinated before, so we are giving TD booster. So what has happened? If the pregnant was there, now she has been vaccinated before. That is what is mentioned in the question. If the pregnancy happened within 3 years, like in your question, within 3 years, we are giving booster. No need to give 2 doses. Any pregnancy after 3 years, then we are giving 2 doses of TD. What has been used in the clinic now, previously we had TT vaccine, that has been replaced by TD vaccine. Important. And remember the number, remember the keyword, 3 years. Within 3 years, if there is any pregnancy, like there was a child with 2 years, that was equal in the question, they are giving booster. If they say a child was with a pregnant, he has been accompanied and the child was of age 5 years, then the answer will change. Then your answer is 2 doses of TD. Or if they give a new pregnant, primary first time she is coming to the clinic, again the answer is 2 doses. So repeat, a new pregnant, 2 doses. Within 3 years, booster. Or if the pregnancy happened after 3 years, again we have to give 2 doses of TD. We have to give 2 doses of TD. Good. So this question has two keywords, rash and ear discharge. 10-year-old boy presents with rash and ear discharge. What can be the probable diagnosis? So what I'm checking and what I can prompt the answer as, mumps, there will be parotid swelling, that will be the clue. Rubella, there is no ear discharge. Chicken pox also, there is no ear discharge. Otitis media can be one of the reason for ear discharge. Otitis media is one of the reason for ear discharge. Otitis media is the most common complication of measles, not diarrhea. Otitis media is the most common complication of measles. If they say rash and ear discharge, or if you are telling like there was an image given, sir, maculopapular rash, which is retroauricular, good, which starts behind the ear, which is retroauricular, then also your answer is going in favor of measles. So rash and ear discharge. I don't want to mark mumps or rubella for this, not even chickenpox. So most of the times examiner is favorable and most of the times he is favorable towards measles because it is very important disease, very important droplet infection, and they have given ear discharge, that can be the most common complication, otitis media in measles. So based on that, answer is shifting towards measles. So as per our recall, the answer is on measles. Safe strategy, you know this, it's very important, used to prevent blindness related to trachoma. So what is S for? S is surgery. Good. So trachoma is being targeted for elimination. That is very important word. Trachoma we have discussed so many times in the classes. It has been targeted for elimination. So all these are expected questions. S, A, F, E. What is S for? Surgery. For trichiasis mainly. You can do it for entropion also. So it is mainly for trichiasis, which can be the leading risk factor for blindness later. So as for surgery for trichiasis. If for antibiotic, again we can use the alphabet A. Azithromycin is used to manage in safe strategy. Previously we had tetracycline. Now chlamydia is the risk factor or the agent for trachoma. So we can use azithromycin. Facial cleanliness and environmental sanitation is very important. Like you will be knowing this, trachoma is very much common in tribal areas where there is improper hygiene. There is no proper water to wash their faces. That will be the risk factor and that will be the reason. So they advise facial cleanliness as one of the component of safe strategy. If they ask trachoma is due to improper hygiene, correct. What is the important recommendation in safe strategy that can eliminate trachoma? Answer is simple. Facial cleanliness is also a part of this safe strategy. So repeat with me. Surgery, good. Antibiotic, yes, correct. Facial cleanliness and environmental sanitation. So safe is for trichiasis, no. Surgery is for trichiasis. Safe is for trachoma. Safe is for trachoma. Good. Now the question has been asked repeatedly. Most of the times we'll be knowing this question. Patient came with class 3 dog bite now, but he had been vaccinated before. Previously vaccinated for monkey bite. Fine, clear. Last time it was monkey, this time it is dog. Fine. The animals are favoring, those animals are fond of this guy. Last time monkey bite had vaccines. Good. Now there is class 3 bite. That means it is not a new exposure. What you are writing? It is a re-exposure. And you have to start re-exposure prophylaxis. Re-exposure prophylaxis. So what is followed in India? Other countries they check antibody titers and they will decide. But in India, what we are following, if there was vaccine history and if the bite was within 3 months again, nothing has to be done. So that is not mentioned when he was vaccinated. If the bite was after 3 months, we are giving 2 doses. Since it is not mentioned, but still the question is based on 2 doses only, because see this, wound cleaning will be done, vaccine will be given, but serum is not necessary now. Immunoglobulins not necessary. Very, very important. Re-exposure immunoglobulins not necessary. Keep this in mind. He has been vaccinated before, body is having antibodies, immunoglobulins not necessary. So 2 doses of vaccine to be given, not 3 doses. Not 3 doses. So what is for re-exposure? Very easy to remember. There are 2 letters. So we are giving 2 doses. We have discussed this. Codes in the class like pre-exposure has 2 letters. We are giving 2 doses. Like this pre-exposure has 3 letters, 3 doses of vaccine. The table has been covered in your classes in detail. My question as per this and my answer is, listen, even though there is class 3 bite now, immunoglobulins not necessary. For re-exposure, we are giving only vaccine. So how many doses? If the vaccine was given and the bite is after 3 months, but that is not mentioned in the question, fine. If it is mentioned, also they will mention like this, bite happened after 6 months or 1 year. Usually they will give questions like this, and your answer will be 2 doses. Your answer will be 2 doses. Remember this part. What is the keyword in this? 3 months. Still the question is not mentioned. In the question this keyword is not mentioned. If I am telling vaccine was given bite within 1 month, then your answer is nothing to be done. Bite after 3 months, 2 doses. But that is the next level question which can be framed in the next exam, I am telling. As of now, the question was very simple. No immunoglobulins, first point. Second point is how many doses. So just keep it in mind. Clear? Note down the keywords what I am telling. Re-exposure, no immunoglobulins. How many doses? 2 doses. Good. Next, coming to questions on nutrition. So most of the questions in this paper is from nutrition chapter only. Around 6 to 7 questions has been asked on nutrition, but all important topic based questions only. Like in pediatrics also they will discuss this image. What is being shown in this? You can see the belly. So it has to be kwashiorkor. So all the options was on kwashiorkor only. Kwashiorkor is due to protein deficiency, not energy. Protein and energy deficiency will be marasmus. So what is the basic difference between kwashiorkor and marasmus? So as you can see the image also, this child what you are seeing, kwashiorkor, here it is marasmus. So emaciation, muscle wasting, what you can see, ribs you can see in marasmus. So here it is deficiency of protein, but here it is protein and calories, both protein and energy. Subcutaneous fat present, edema present, fatty liver present. So remember 3 points: subcutaneous fat, edema, and fatty liver. Here I'll write minus, minus, minus. Good. The next thing, very important, as you can see in the image, ribs are prominent. Irritable child, muscle wasting, voracious feeder. So this side you can start writing plus, 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 plus. Ribs present, prominent, voracious feeder, irritable child. So there is prominent muscle wasting. And for marasmus and for muscle wasting. Since there is muscle wasting, ribs will become more prominent. The child is voracious feeder. The other side, complete opposite. Lethargic, some sort of muscle wasting, and poor appetite because the child is having everything: belly present, fat present, edema present. So the child will not feel like having something. Indirectly, you can remember like this. But here, the child is having muscle wasting, irritable child, voracious feeder, ribs are prominent. So this is the basic difference between kwashiorkor and marasmus. As per the image, you'll mark in the exam. It's not a difficult thing for you. So once the image is given, like if there is edema, fatty liver, belly protuberant, all these are given, then you'll come to know it is kwashiorkor. But the question was based on biochemical part, like it is due to what deficiency. So it is due to deficiency of proteins. So what is the recommendation? Start giving proteins. But the other side, protein and energy. So protein has to be given, and for energy we need to give fats and carbohydrates. So proteins, fats, and carbohydrates. So since there is energy deficiency also, we have to give fats and carbohydrates, which are important part of energy given in the nutrition part. Clear? So come to the next question. Good. 8-month-old is the keyword in the question. Vitamin A supplementation is asked, not prophylaxis. So underline the words 8-month. Vitamin A supplements to be given over the course of 2 consecutive days, today and tomorrow. That means child is having some risk factor. Like usually if I say child is having measles, example I'm telling, when the child is recovering from measles, we are supposed to give 2 doses on 2 successive days. But if bite out spot present, you are seeing bite out spot, then you are adding 1 dose extra. So example, if there is a child of measles recovering child, there will be vitamin A deficiency. We are giving vitamin A supplementation, not prophylaxis. Prophylaxis part is completely different. That is in vaccine schedule. So here it is supplementation since there is nutritional deficiency. 2 doses given on 2 consecutive days. But if there is bite out spot, we are adding 1 dose extra. This is vitamin A supplementation. Boss, I'm telling this is vitamin A supplementation, not prophylaxis. Good. Now the question is on dose. 8-month-old child. So if the child age is between 6 months to 1 year, we are giving 1 lakh international units. We are giving 1 lakh international units. So what is the dose? We have discussed clearly in the classes under measles part. Less than 6 months, 50,000 international units. 6 months to 1 year, 1 lakh international units. And more than 1 year, 2 lakh international units. So this is for vitamin A supplementation. Vitamin A supplementation. So vitamin A prophylaxis is totally different. That is starting at 9th month, then again at 18th month, then every 6 months once. So that is totally a different question. Don't mix that question with this question. Here it is between 6 months to 1 year. The answer is 1 lakh international units. Come to the next question. Again, the question was very, very easy. Which vitamin deficiency will affect the eye, causing dry eyes like xerophthalmia? So it is the ocular manifestation what they are asking. Vitamin A deficiency can have both ocular and extraocular manifestations. So the question is direct on vitamin A again. It is this vitamin which is, or this vitamin deficiency which is causing ocular manifestations. So you know the classification, right? WHO classification. So first is night blindness. That is the symptom what the patient is experiencing. It is not the sign. This is the symptom initially. Then all the things what you are seeing there, that will be signs, like starting from conjunctiva. There is xerosis. Then there is Bitot spot, as you can see in the image. Then there is Bitot spot. Then it affects cornea. Cornea, first we have dryness, corneal xerosis. Like this, there is corneal xerosis. Then there is ulceration. We have two things depending on the involvement, how much amount of cornea is involved, corneal ulcers. So repeat, first conjunctiva, that is dryness. The next stage is Bitot spot, means it is becoming more deeper and deeper. Then cornea, first there is dryness, xerosis, then there is ulcer, that is keratomalacia. Then as you can see in this image, corneal ulcers के बाद corneal scarring. Here you are seeing corneal scarring. So these are the manifestations. So later it can affect fundus also. That is the next last stage. After corneal involvement, it can go deeper and can affect fundus also. So starting from conjunctiva, you are going deep, 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 deep. So what they're asking, most of the times they're asking the classification of keratomalacia, that is corneal ulcers for you. So the question was not that difficult, but this is the extra information what I'm giving for you. So that in the future, if the examiner is knowing, like we can ask a question on xerophthalmia or vitamin A, they can ask question on classification also. It's always about reading the mind of the examiner, staying with the examiners, so that what they are thinking, what they are predicting in the future, that can help in, that is what the purpose of recall and analysis is. So next question, as I'm always saying, there can't be a question in the exam without pellagra. So pellagra, what you are saying, diarrhea, dermatitis and dementia. All these are direct questions from your class notes, nutrition part. I'm telling again and again, nutrition is very important. Maybe in the recent like 2-3 years papers what I'm checking, nutrition part is very important. Pellagra, usually they will ask manifestation, or they will give Castle's necklace, or they will give the cereals responsible for pellagra, or they are giving the direct question like this what they've asked in the exam. Pellagra is due to deficiency of which vitamin? So it is B3 niacin deficiency which can cause pellagra. So what is the skin involvement in pellagra? They can show this very repeated, very simple question what they are asking. Castle's necklace. Castle's necklace is seen in which vitamin deficiency? Pellagra. What you are seeing, the excoriations in the photo exposed parts. These are excoriation in the sun exposed or photo exposed parts, and they will give question. Most of the times PSM related question is on consumption of maize or consumption of jowar. These two cereals or millets are responsible for which deficiency? It is niacin deficiency. So the reason you know maize is lacking tryptophan, lack of tryptophan. Here it is rich in leucine. Here it is rich in leucine. So lack of tryptophan, you'll be knowing the biochem part. Good. Repeat with me. Yes, correct. Yes, what you're telling is correct. Tryptophan is converted to niacin. This cycle is very important. If there is lack of tryptophan in case of maize consumption, there will be niacin deficiency. And if the jowar is rich in leucine, leucine will block the conversion. This is very important. Leucine will block the conversion from tryptophan to niacin. So pellagra is due to consumption of maize, correct? Jowar, correct. So both the cereals are responsible for niacin deficiency. The reason is within biochemistry. Maize lack of tryptophan, jowar is rich in leucine. Good. Incisors are involved. The first keyword in the question was incisors. Always keep your calmness in the exam. Just look at the keywords. You have read, you have revised most of the times. In the exam, application part is also very, very important. Your focus is only on the keywords in the question. Don't panic. Even if you don't know the answer, nothing will happen. There is nothing to lose. Have that stable mind. There is nothing to lose, but still I have to read the question. If I get the answer, I'll mark the answer. It's not that I will not mark the answer because there is nothing to lose. Not like that. Have that status, have that focus that I will search for the keywords in the exam. If I get the answer, good, you will get the answer. I'm telling. Keyword incisors. One, there was white patches initially mottling, then it turned brown. The next stage of dental fluorosis is due to over supplementation of what? So what they're asking, it is related to teeth, fluorine, it is fluorosis. So fluorosis is due to excess of fluorine consumption. If the concentration is more than 1.5, it will affect teeth, dental fluorosis. If the concentration is more than 3, it will affect bone, skeletal fluorosis. If the concentration is more than 10, it will affect the movement. The patient will not walk from place to place. That is disability, crippling fluorosis. So what are you supposed to do in case of fluorosis? You'll be doing defluoridation, Nalgonda technique. But that is the next question. Here the question was direct teeth involvement they're giving. But if they frame two-dimension question, the next part what they will ask is what technique is used for preventing such manifestation affecting the teeth and the incisors. I'm showing the picture. Listen. This is how it started actually. The question is saying mild fluorosis, mottling. Then it has turned to severe part, brownish discoloration due to over supplementation, means it is in excess. So you have to mark this answer because vitamin A, chlorine, riboflavin, these are the options nowhere related to teeth. Even if you don't know anything, just by seeing incisors, I am not reading any other thing in the question. I will mark fluorine and I will go to the next question. But still, you should know what is fluorosis, what is dental fluorosis. Good. Which oil is preferred to decrease the incidence of cardiovascular or coronary artery diseases? So usually what we prefer most of the times, it is omega-3 fatty acids. This is the answer. The oil rich in omega-3 fatty acids are preferred and it is a preventive part. Omega-3 polyunsaturated fatty acids like for example alpha linoleic acid ALA, or you can say EPA, eicosapentaenoic acid, EPA, or there is one more like DHA, docosahexaenoic acid. So if they ask what will help in prevention of coronary artery disease, you can say 3 things. They can give all except question also, but they are giving questions at one dimension level. They are not asking what are omega-3 fatty acids. Just they are telling omega-3 fatty acids will help in preventing coronary artery disease. And one more question on nutrition, just basic question on nutrition. Classification, like we have major elements and minor elements or trace elements or micro elements. Which of the following is not a micro element? That means it is macro element. That is calcium. Usually we need calcium in larger amount. So odd man out, even if I don't know the question, if they give these 4 options for me and if I am playing a game odd man out, usually if I don't think too much, if I don't know too much, I will mark calcium. If I know too much, then something like selenium will become the answer, iodine will become the answer. But as at ground level, if I don't know anything, just if they give me 4 options, sir, play odd man out, then I will mark calcium. Because calcium is very important for me, I need calcium in a larger amount. Based on that basic ground level of idea, I'm marking the answer as calcium. So macro elements and micro elements. Micro elements sometimes we take it as trace elements also. So macro elements we need in excess of 100 mg. Here it is less than 100 mg. So usually what we come across, like calcium, highlight this, phosphorus is important, potassium is important, and magnesium is important for me. Here it is iron, copper, zinc, iodine, and selenium. So if you remember one side, that is enough. No need to read both the sides, because sir, it becomes very difficult for me and it becomes confusing for me to read both smallpox and chickenpox, or macro elements and micro elements. So let's keep it simple. I will know one side. If the examiner is asking which is not a micro element, then I'll check the answer and the answer will be calcium. So let's play safe. Let's play as simple as possible. Don't be too greedy in remembering both the sides. Just remember one side. And if you are getting the answer, that is what the outcome is. I want the correct answer in the exam, not that how much I know. How much I know is also important. But if I know this much, that is enough. That is also the next level of thinking. How much I know is important, but if I know this much, that is enough, and that is called as satisfaction. And I got the answer as calcium. Good. The next question is on demographic cycle. Highest birth rate is seen in which stage? That means they're asking question on demographic cycle, high stationary stage, where there was high birth rate. Long back, you might have come across your grandmothers or grandfathers telling their stories. There were 10, 12 births in my house, and out of 10, 12, around 9 to 10 died. That means there was high number of birth, high number of deaths also. So as you can see here, I'm showing the image for you. This is stage 1. Stage 1 of demographic cycle, what you're seeing here. Stage 1 of demographic cycle, where there is high birth rate and high death rate. High birth rate and high death rate. So birth rate is equal to death rate. Birth rate is equal to death rate. If birth and deaths are almost equal, growth rate becomes 0. Population is stable at the higher end. That is why stage 1, which is having a 0 growth rate, not positive, not negative, there is 0 growth rate. That stage is called as high stationary stage. If they don't mention stage 1, they can give like this also. Stage 1 is also called as, repeat with me, very good, what you're telling is correct, is high stationary stage. So highest birth rate is seen in which stage of demographic cycle. So what they're doing when I'm coming across the question and I'm discussing chapter wise, what I come across, what I'm observing is they're giving importance for most important topics. Like there is one more question on contraceptive, like 380A. What they're asking, they're not asking difficult question. They're asking one liner like this: shelf life of property 380A. Highest answer is 10 years. You have to look for the option which is highest number 380A. So it is highest shelf life. Answer is 10 years. Don't guess and mark 5 years. So I'm giving the shelf life of different contraceptives, just mugging up one liner question. There was nothing in the question. So if I say copper T, then I'll say 4, 5, 10. 200, 4 years, 380A, 10 years. 200, 4 years, 380A, 10 years. In between, we have one more property which can be asked in the exam, that is 5 years. So just start 1 year of shelf life. But usually what I've come across in most of the exams, they're asking question on these three things. Highlight this: 4, 5, 10. Remember the numbers. Repeat with me. Good. Yes, what you're telling is correct. 4, 5, 10. What was the answer for this question? Again, I'm asking. Good. It was 10 years. Very good. There is one more question on contraception that is related to family planning, vasectomy. After vasectomy, how many days the patient should use barrier methods? So we advise barrier methods. So the answer, what is taken from the books. See, listen. The patient is not sterile until 30 ejaculations post vasectomy, or in months it is written as 3 months. Usually they will ask ejaculation based point, or in months it is 3 months. They have to use this barrier contraceptives. So 3 months, the approximate answer is option C, 12 to 20 weeks, because there is no other option fitting into the answer. 3 to 4, 6 to 8, 20 to 24 is not the thing. So approximate answer which is fitting in is option C, 12 to 20 weeks. So primary, giving birth to a child. So both mother and baby are safe. The question is direct. Within how many hours they have to start breastfeeding? So breastfeeding as soon as possible, but within hours, if they ask, it is within 1 hour. We have to advise and start exclusive breastfeeding. That means breastfeeding will start now, and exclusive breastfeeding is still 6 months. Later they'll start complementary feeding, and we advise to continue breastfeeding till 2 years. So initial question, there was nothing in the question like immediately, as soon as possible. So within hours, if I'm asking, it is within 1 hour, within 1 hour. Essential components of RCH program, very old question, but they're framing the questions from your textbook PARC. So within PARC, they're still giving some points related to RCH program. Now it is RMNCH plus A, and even nutrition component is also added. But still the question has been framed on RCH program, which is not an essential component. So there is nothing like empowerment part. You could have ruled out the option. There was nothing related to education and empowerment. Totally different. RCH program is within health ministry. Empowerment and all this education part will go in women and child development ministry or education ministry. So based on that, you could have taken the answer. And the question, and the examiner is framing the question. Within the options only, you'll get the answer. If I'm telling motherhood, child care, screening for STDs, all this will be health component. So RCH program is related to health, not related to education and empowerment. You could have taken a guess in the exam, and the guess will be right most of the times. Good. By giving a proper guess, I'm telling by giving a proper guess, like this is health program, which is not a health component. Education, empowerment is nowhere related to health. So you could have taken the guess, and there are 4 components of RCH. These are essential components: family planning, child care, child survival, safe motherhood, and also preventing reproductive tract infections or STDs. That is also a part. And one more component is how to approach client approach to healthcare, what they are thinking about RCH components. These are 4 important components. So child care was in the option, motherhood was in the option, this was in the option. Which was not related to this was women education and empowerment. Women education and empowerment. Again, I've seen question on infant mortality rate. We have a table in your notes. So all these questions are directly from your textbooks and easy topics which has been covered in your classes, which is the unit of infant mortality rate. So usually what we say, the denominator is live birth, but they're not asking options. What they're giving is a merger of unit and denominator. The unit of infant mortality rate is always per 1000 live births. So what is the numerator? Infant deaths. What is the denominator? Live birth. For how many live births we express infant mortality rate? It is for 1000 live births. So option B is the answer. What is the unit of maternal mortality ratio? 1 lakh live births. In India, it is 1 lakh live births. Maternal mortality ratio. If I change the question, what is the unit of maternal mortality ratio? Then your answer will become 1 lakh live births. Now the answer is 1000 live births. Student related question in school. So there is a question on school health also. What is the per capita space for one student in a school related to school health? So more than 10 square feet will be the answer. So what are the important points you should remember related to school health? Classroom should have how many students? 40, not 30. Doors and windows for ventilation and lighting should cover more than 25% of the floor area, not less than that. There should not be congestion. At the same time, there should be proper lighting and ventilation. Toilet 60, 100. Urinal for 60 students, latrine for 100 students. That can be asked. And minus type of desk should be used. You know this question. And the question which was a bit difficult for you, because this was been asked very long back, but again they repeated the question. But this was a bit difficult because one liner, remembering the numbers will be difficult, I know, because these are factual questions. But still, if the question repeats on school health in the future exams, please note this table. I'm telling, I'm giving all the points in a concise, crisp manner in discussion part, so that what can be the examiner's question in the future exams also. So keeping that in mind, telling the answer for this question, the same time predicting the question and answers for the future questions. That is the main purpose of recall discussion. Good. ESI scheme, maternity benefit. The question was on ESI scheme and maternity benefit. We give 100% of the wages. The maternity benefit is for how many weeks? You know the table, it is for 26 weeks now. Thank God there is no 12 weeks in the option. 12 weeks was the old question. Now there is 26 weeks of maternity benefit for a normal confinement in pregnancy as per ESI scheme. Then Maternity Benefit Act also says the same number. ESI company, ESI corporation is under Ministry of Labor and Ministry of Labor and Employment. Ministry of Labor and Employment, remember. And now the benefits what ESI is giving: sickness benefit, normal illness for 91 days, 70% of the wages what they are providing as a part of insurance, ESI company. Chronic diseases, extended sickness will be given. 80%, a bit more, it will cover 34 diseases. Tuberculosis is also a part of that. This can be a question. How many years? 2 years. Because it will cover chronic diseases. Which benefit will cover chronic diseases? Extended sickness benefit. Enhanced sickness benefit is for vasectomy and tubectomy, sterilization purpose. 7 days, 14 days. Full wage, 100%. So you can remember in ascending order: 70, 80, 100. 70, 80, 100. 7 days, 14 days. Female, obviously they need more leave. 14 days is given for tubectomy. Maternity benefit, very easy question. Usually I highlight this point in my classes also. 26 weeks, 100% of the wages. Now, in case of injury, disablement benefit is 90%. Either it is temporary or permanent. Death, after death, family members will get pension and funeral expenses will be 15,000 now. Previously it was 5,000, then it became 10,000. As of now it is 15,000. If I want to predict the question in the future, most of the times they'll frame a question on chronic diseases, extended sickness benefit. Highlight this part. They'll frame a question on extended sickness benefit. They'll give a question on MDR-TB or XDR-TB, like that. They'll frame an indirect question on extended sickness benefit. One more question on occupational health, that is ground glass appearance of lungs, as seen, the image is seen in asbestosis. So usually the basal area which is involved, and there is nodular fibrosis. There can be pleural involvement also, nodular fibrosis. So A for asbestosis, next letter is B, B for basal involvement, remember, like that. Usually it is involving the basal part, base. Top is silicosis. These are a merger, like this question is a merger of radiology also. And occupational interstitial, like pneumoconiosis, will be knowing ground glass appearances seen in asbestosis. Giving a class in a village related to wound dressing after dog bite, like we have to wash with soap and water. Don't apply chili powder, or don't apply anything. Don't apply any irritants. Just we are giving a class like how to wash the wound with soap and water. No need to give lecture for that. Don't make them sit and you are telling and you are like that. That is not necessary. Flashcards sometime it will become difficult for them to grasp thing because it is a village people. They won't understand much if you are portraying and showing this is the way. It the reach what you are getting is very less. Group discussion not necessary. If they are villagers are sitting and they will discuss related to dog bite wound dressing, they'll think of which dog, how to beat the dog, and they'll which chili, how much chili we have to put and all. That is not because they don't know anything. Don't let them discuss. But it is from your side what you're giving. Answer is demonstration. Even how to use ORS, how to make ORS, that was the previous question. That was also demonstration. Here also the health education method, what you're giving is demonstration. Very good question. They are giving importance for each and every chapter. Also, what you are going step by step in Park textbook. They are giving one or two questions on each and every chapter. So come to the next question. One more question on health education and communication chapter. The question was on barriers of communication. Like if you are communicating something to the people, like what can be the barriers, why it is not reaching them. So barriers to communication. So doctor is explaining to the community that after vaccination it won't affect or it won't lead to impotency. So vaccines what you're taking, it has nothing to do with impotency. This is what the community was thinking. Like if I take vaccine, I'll become sterile, impotent. So now the question is in front of health educator that you have to tell that it will not affect such things. So what is happening? What is this type of barrier? What the community is thinking? Vaccine will lead to impotency. This is what the community is thinking. So to come across, this is the barrier for us now. What is this type of barrier? This was the question. Actually, when you come across the barriers of communication, there are four barriers. Environmental barrier means there is noise or there is crowding where you cannot reach. What you're telling is not reaching because everyone is crowded and nobody is listening to you. There is complete noise, like they're telling, oh, and all. It is not reaching. What you're telling from this side, that is environmental barrier. That is not in the question. It is not in the question. Psychological barrier, there can be emotional disturbance or neurosis. Patient is completely down, like if it is completely depressed or there is some emotional disturbances, what you're telling, they're not listening. Like there will be some neurotic or emotionally down patients, they'll be thinking their own thing, but what you're telling is not reaching their ear. What you're telling is not reaching their ear. You're telling it will not lead to importance. They'll be thinking, oh, what is- that emotional disturbance was in the patient and your thing is not reaching the patient. That is psychological barrier. That is not in the question. Like if I am telling, you're explaining to the community and they are emotionally down or disturbed, if I mention such good thing, then it becomes psychological barrier. That is not the answer. Physical barrier, either vision or hearing. There is no mention in the question like the patient is blind or patient is deaf. Like this they are not giving this, so it is not physical barrier. So the thing what is fitting is cultural barrier. What is written in the books, it is related to their beliefs. This is what the belief the community. Vaccine will lead to impotency. We should not take vaccine. That is the belief what they're having. This comes under cultural barrier. So ruling out, there was noise, no, not environmental barrier. Emotionally down, no, not mentioned in the question. Physical, no, deafness, no, blindness. So go for cultural barrier. Your answer will be correct. Answer is cultural barrier. This is one important question. And the first time they have used this word extended family in the option. And you can come across the previous year questions. They have not given questions on extended family. First time the examiner is thinking about one family where the answer can be extended family, where the answer can be extended family. I'm not telling the answer is extended family. I'm telling the answer can be extended family. So why? Because see the question. A 35-year-old man began planning for vacation with his pregnant wife and one child. Means this is one family. This is a nuclear family. But what the examiner is adding, at the same time his brother and wife came to visit him. So there is one more family coming for a temporary visit. It is not permanent, it is temporary visit. This is one more keyword, temporary visit. Now you are going into that house. There is one family and there is one more family for a temporary visit. So when you are going and checking what type of family you will get. So nuclear family, no, because there is one more family giving a temporary visit. Third generation, no. Like 1, 2, 3 generation, no. Either your answer has to be joint family or extended family. Let me tell what is nuclear family first. Couple with children. That is one family, nuclear family. Joint family means married couples with their children. First brother, second brother, third brother. Married couple with their children. Staying together. Good, looks good. I'll put one smiley to this, but that is not the answer. They stay together in a house and property is held in common. Most of the time, the decision maker will be a senior male member, can be elder brother. That is joint family. Three generations together, like 1, 2, 3, grandfather, father, and their sons. That is three generation family. Three generation family. And now the question is, what is extended family? First time you'll come across this word. Couple with their children and their relatives coming for a temporary visit. So this is what the examiner wants the answer as. So when I checked for the definition of extended family, I got this definition in most of the documents, like couple with their children and one more family or one or two relatives coming for a temporary visit. That is extended family. Like if there is one more aunt or uncle, he was having some illness in the village, he is coming here to the city and to stay with his brother for a temporary visit to get his treatment done, maybe for 15 days or 1 month. That is extension, extended family. So repeat, nuclear family means one family, that is clear. Three generation is 1, 2, 3. Now you are telling sir whether it is joint family or extended family. And extended family was in the option. Examiner is thinking like that and is giving some scenarios like this temporary visit, one family was there. Like if the examiner is framing such questions and is giving the option as extended family, you don't want answer as joint family. Joint family means living together on a permanent basis, they stay together, property is held in common, and the decision maker will be the senior male member. So those are points which are going in favor of joint family. So again I'm telling, as per the recall, as per the words what the examiner is using, and as per our search for definition of extended family, our answer will be extended family. Good. So my answer is extended family. A bit tricky question. Eligible couple register. This was an expected question. Like the previous question was a bit tricky. This question is expected. Healthcare, they will ask sub-center question. Eligible couple register, how many are in need of contraceptives, how many are using, that is maintained by ANM, auxiliary nurse midwife. At what level? At sub-center level. So who will do this work? Female health worker, also known as ANM. It is at what level? It is at sub-center level. What is the recommended expenditure or percentage of GDP which has to go in public health or health related things? How much government should sponsor? How much the patient will give, that is out of pocket expenditures, fine. But how much the government should give? As per the health policy, it should be 2.5% of GDP. 2.5% of GDP. What we are spending, it is around 1.2% as of now. We are spending 1.2%. So health should be given more importance. That has to reach 2.5% by the year 2025. By the year 2025, you can remember the number 2.5, 25 almost looks similar. 2.5% should be the answer. If that is there in the option, that will be the answer. If that was not in the option, some students tell, sir, it is 2, 3, 4, 5. Then usually one more document it is written like 2 to 3%. 2 to 3% of GDP should go in health. So based on that, I'm taking the upper limit as 3%. So again, I'm telling answer should be 2.5%. If that is there in the option, 100% that will be the answer. If at all that was not in the option, then take the upper limit as 3%. Upper limit as 3%. So come to one more question, the last question on statistics. They asked very simple question. They want to assess food habits of multiple religions in Delhi. The sampling method which is suitable for this heterogeneous population, because religion wise the population will be different. So religion wise the population can be in different numbers. It is heterogeneous population. Divide them into subgroups and take the samples. Take the samples according to their size. Divide them into subgroups and take the samples according to their size. This is what type of sampling? Stratified random sampling. What is stratified random sampling? What you are doing is making three different groups, which was heterogeneous because their size is different. So you separate them into A, B, C. This is strata. That is subgroups what you are making. Then based on their size, you are selecting the sample randomly. That is why it is stratified random sampling. Stratified means three different groups what you are putting. Stratified random sampling is used for what type of population? Heterogeneous population means different sizes. Usually it can be based on religions, or it can be based on sex, or it can be based on race. Sometimes it can be based on age also. What you are doing, stratification you are doing is based on certain characteristics. That is also correct. Stratification is based on certain characteristics. So answer is stratified random sampling. All my test and discussion papers, what I put, every paper I put a question on stratified random sampling. What I think is examiner will ask stratified random sampling most of the times. So we are putting stratified random sampling in most of the T&D papers, and this was very good question, like different religions, different proportion wise, and pick the sample based on their sizes. That is stratified random sampling. So we have finished almost 31 questions what we have compiled as of now in PSM. The major part was on nutrition. Almost 7 questions was on nutrition. So maybe in the future also I can predict most of the questions from nutrition, demography, mother and child related question, ANC, TD vaccine, or child breastfeeding related, infant mortality rate formula, maternal mortality ratio formula, like that. Sometimes they'll put question on occupation related ESI scheme and those questions, health education related questions also. And if the examiner is favor of epidemiology, they'll put the initial things, study designs, levels of prevention, infectious disease epidemiology. Slowly they're reducing the number of statistics questions. They're putting more of concept oriented statistics rather than asking calculations. As you can see here, there was no single calculation asked in this exam. Maybe in the future I can say they can ask calculation, but maybe one or two step that's not like deep calculation, one step or two step calculations, or directly they will ask the formula based question, like what is the formula for infant mortality rate, as you can come across that question which has been asked. So again I'm telling, nutrition is very important. Even communicable disease is very important, or they will put a question on communicable disease related vaccines also. So overall analysis part, what I'm telling, miscellaneous topics are also asked and they're given importance in this paper. So yes, I'm telling the paper was from Park. Most of the questions, almost 90-95% of the questions was directly from Park. They have given the scenarios. Like if I'm telling barrier, they have made a question on cultural barrier. They have given like dental fluorosis, they have made a scenario on dental fluorosis. Like that, they are keeping the scenarios for you. Good paper, very good distribution of questions. Hope it was clear. So no need to go deep into that, like I've done this wrong, that wrong, and all fine. Our purpose was to go through the questions like what is the correct answer, what is the correct probable answer. At the same time, these things should help in the future papers also, like what are the topics which they are focusing on, what can be the questions which they are predicting, how they are predicting the questions, like what is the way of forming the questions. So again, fine. Hope it was clear for you. It was clear for you. Thank you so much. All the best. Again, best wishes.